I'm Dr. Malhar from JOSHI'S Veterinary Clinic. I am owner and founder of this clinic. We work in Malhar. Today in this podcast, we have Mr. Tanmay Juvekar, who owns Good Doggy, the grooming brand, and he's well known for his grooming expertise. Hi Tanmay.
Hi Malhar, thank you for that lovely introduction, and I would like to add on to that we completed 8 years in the business.
Congratulations.
So this comes together quite well with having this podcast with a vet. So yes. And also exposure to grooming, I mean is grooming at a certified groomer.
Yeah.
And not your, back-end shop which has a grooming attached.
Yeah. Someone who claims that he knows how to give a bath to.
Yeah, or some such shops or like that. So it is better to go to a certified groomer who knows how to hold the dog on the table, who knows how to hold his chin, lift his legs. Even while lifting a leg, you have your certain degrees.
Yeah.
Because you have your joints there.
Yeah.
So all these things matter when you're going to groom, because that all is going to condition the dog to like it.
Yeah. Do you take any extra precautions for senior dogs or medically compromised dogs?
So for senior dogs and medically compromised dogs, we have a consent form that we get signed. Because
for animal,
yes. So there is a consent form.
Yeah.
Which has to be signed by the owners. Because it's a senior dog, there is a certain limit that we keep. If your dog has turned 13, I have the option of grooming or not grooming the dog, because it's an older dog now. Traveling all the way to me is going to get hectic. The dog itself is deteriorating now. It has its ailments that are going on, maybe arthritis, maybe heart issues, maybe certain failures are there, renal failure is there, because it's an older dog. Now for such dogs, what we do is we have a consent form, and the owners need to sign it, and only on their acceptance of the form is when we allow the groom to happen. Otherwise, if your dog has reached a mark that we have set for ourselves, your dog is not coming to us then onwards. Then onwards, we shift it to probably a known home groomer that can come home and groom your dog in his own comfort. And if you are comfortable and your dog is hale and hearty, like the other day I groomed a 16-year-old lab. Like, she's wonderful. She comes walking on her own 4 legs. Her eyesight is wonderful. She can hear. Like, if you look at her, you won't know she's 16 years old unless the owner tells you. Okay, so now such dogs are okay. Okay, and during such dogs or cats that come, which are older in age, we make sure that at least one family member is sitting there.
Okay.
Because grooming such dog is a risk.
Yeah.
Anything can happen on the table.
Any medical emergency
can happen. Anything can happen. There can be a collapse in the dog, or he can go in tremendous pain all of a sudden if he has acute arthritis. So to take care of all that, we make sure that our pet parent is there along with us, and the pet parent has signed the consent form and given us the authority to, okay, now you can groom.
Yeah. How can grooming help in early detection of ticks, fleas, or any skin parasite?
I mean, grooming early detection, actually, like when the dog comes to us, okay, for a thing like when we do the haircut or we do the general test. Okay, that happens for every groom. We check their skin, we check their ears, we check their eyes, we check their paws, we check their sensitive areas, we check their armpits, we check their skin for knots and ticks. Now this happens for every dog every time he comes to us. Every dog or cat.
Yeah.
Okay, and then we make a note of it and we tell the owner, okay, these are the issues that your dog has. So only when the dog comes to us, we can see if he has ticks and fleas. And even if we see 1 or 2, we make sure we have informed the owner.
Okay.
And
what is your part when you find the parasite? What should you be doing as a groomer?
Generally, when we see it, what we do is we use a regular tick and flea shampoo, which is not too heavy. Okay, and from there onwards, we ask the owner what you want to do. Do you want to do a spot on application? Is your dog on any tablets like we have?
Yeah.
Okay. Or your dog is comfortable taking injections. If so, please go ahead and get it done. If the owner tells us that you can apply spot on now just because we have a pet shop aligned with us, they buy it, they give it to us, we apply it for them.
Okay.
So generally what we suggest is lock your process. When you see a tick and flea issue, make sure you've had a tick bath and immediately you've done the medication.
Okay. One question was there always in my mind, but I never asked any group. You were the first person who wanted to ask. Let's say multiple dogs are coming in. We have a line of dogs. Some are normal fit and fine, and some have some stress infections. Do you feel that they can transmit the infections to each other during grooming sessions?
Unless it's a kind of infection that gets transferred.
Yeah.
So yes, it can transfer. But generally what happens is when you call me and you tell me that okay, your dog has an infection. If you tell me it's a fungal infection, we generally talk on WhatsApp with the clients, we get the prescription, we do our own understanding about it. If it's a something that's going to spread to other dogs, what we do is we call them separately. We do not give them appointments. We call them separately so that once the pet is on the table, the whole thing can be sanitized.
Yeah.
Now I have groomed dog who had mange.
Okay.
Okay. After that we had to clean the whole shop, and at that moment I didn't know that the dog had mange. So what happened? Thankfully, like by say my luck or something, he was the last dog for the day.
Yeah.
We groomed him.
So I shut the shop for 4 days.
So I shut the shop for 4 days. And I cleaned the shop with a solution that comes mixed with an insecticide, pesticide. I cleaned the whole, shop.
Yeah.
And then once I felt like it was okay, I asked the vet, and he said it's okay. And then I opened. Now taking learning from there, now what we do is we ask them to give us their prescriptions. And every time, even if it's a normal fungal infection, the tools that are used on them are then sanitized. Okay, they are left alone for a half an hour, 1 hour.
Yeah.
Double sanitization is done. You do get your tool sanitization sprays from our suppliers and we use them on them. Even the towel that is used on the dog is discarded for that particular day unless it's going to be washed. And then we carry on. So we try to take as much as precaution possible.
Okay.
That is only when we have the knowledge of it. If someone has not told us that your dog is going through something like this and even we can't visually see it, okay, then there are chances that it may slip between the cracks.
Okay. Any hygiene practices that you would recommend that you follow for other groomers or other budding groomers?
I mean, sanitize your tools every day, or every day as in basically after every groom. If possible, after every groom. Wash your tubs and tables after every groom. You make your solution and keep. In a spray bottle. You make it, you spray it, you wipe it. Most of our vets also we do that. You have your solution made, probably you're using Dettol or whatever. Okay, you're using whatever solution you want. You make a spray, you spray your tub, table, everything, clean it. Make sure you have kept a 20-minute gap between the next groom. For that particular table. I mean, if you're a groomer who has 2-3 tables, it's okay. Other 2 tables can be occupied. That table can get occupied after 20 minutes of having that resting. Those tools which are there, always have tools in surplus. If you have 2 groomers working for you, have 3 sets of everything. Because then that one set is barred till the sanitization is taking care of all the things. Okay, spray your things and wash your towels regularly. Make sure that if there's a tick and flea, a dog who's presented himself with number of tick and flea and you're going to do some kind of pest control, maybe with a solution what you get in the market or whatever you're going to use. Make sure it has a 24-hour sitting time because the fumes from those solutions take 24 hours to go. It affects humans as well as the dogs, irritation. And these are quite toxic. So make sure to wash your hands. Hygiene. I mean, get your vaccines done yourself. Get your pre-exposures and most.
any tips on managing aggressive or anxious dogs during grooming sessions?
Tips, I mean, see now, what I can tell you is, being a groomer, I also come from a canine training dog, like canine training background.
Yeah.
Like, you know, I've done it under Shireen Merchant. Now, when I come from there, what happens is, what we have been taught is understanding why the dog is doing this.
Okay.
So if you right now start being rude to me, okay, in this conversation, I have to understand the trigger.
Okay.
In this whole process, what I spoke triggered you.
Okay.
Now, when I understand that, going forward, I will know how to manipulate that situation.
Okay.
That comes to me and my expertise. How to manipulate and not make you react to it.
Okay.
Even though I'm going to use it. The trigger is going to be there, but it's manipulated in such a way that you like it now and you are not getting rude. So it is same with the dogs.
Okay.
And aggressive dogs. Okay, now if it's a genetically aggressive dog by birth, because of maybe inbreeding or something, we can't fix it.
Yes.
I am not going to groom that dog. That dog has to be groomed under sedation. There is no point in worrying that dog further.
Yeah. We'll have a rapid fire round where you will answer rapidly in a 1 or 2 words.
Okay.
Frequent bathing causes hair fall.
True.
Human shampoos are okay for dogs.
False.
If a dog isn't scratching, skin is healthy.
Sorry?
If a dog isn't scratching, means skin is healthy.
Not true.
Grooming is only cosmetic. Dekhawa.
That is maybe.
One grooming mistake that you see often.
Zeroing the breeds that are not supposed to be zeroed.
Yeah. One health sign owner should never ignore.
Your dog has not eaten 3 meals.
Okay. Best investment for dogs under 2000 rupees.
Best investment for dogs under 2000 rupees. Getting a spa done at the Good Doggy, 1680.
Consultation in JOSHI'S Veterinary Clinic. One product you recommend and one product you don't.
Moisturizing shampoos,
Okay.
which are suited for your breed, and something that I don't recommend is buying products based on the price.
Okay. Most underrated aspect of dog care. रॅपिड फायर आहे परत विचारतो
ठीक
मी.
आहे ना, थांब 1 मिनिट थांब, मला विचार करू दे. Most underrated aspect of a dog care is probably you and me. The value
Yeah, the value.
that we should get,
Yeah.
that we don't get.
Instead of googling and watching
Chat
YouTube
GPT.
videos. Yes.
My
Chat
dog
GPT.
is vomiting.
Okay. So that's how we end our rapid fire.